When I was practicing internal medicine, more or less the way I had always dreamed of it, being in a relatively small town with a close association with patients in the community where I lived. So it was somewhat ideal. I was finding that my advice, while I thought was very good and well versed in my training, that people weren't always getting better. At the same time, this was in the early 90s, managed care health plans started to become very prevalent and having influence in the way people were being taken care of. Namely, that some of the decisions that I would have made for them were second-guessed by bureaucrats in institutions other than mine, and ultimately altering the courses of therapy. There were a couple of times when I felt that as a result of that, the health care I was providing was less than ideal. And so I started to rethink what I was doing and what system I was working within. So that's where I started to see some limitations in the system as it was designed. In addition, though, while I would give advice to people, sometimes about lifestyle, I was not well prepared to really help people make the changes in their lives that I thought were really important for them to take better care of themselves. I realized when I would prescribe a medication, for instance, that if I was on the other side of the desk, if I was the patient being told to take a medication for my blood pressure, I would ask the natural question, what else can I do? Because I would want to do anything other than take a medication, and that's most people's initial reaction. And here too, I was not very well versed in alternatives. I felt it was my responsibility then to learn about them. And over time, I realized that it was a problem that wasn't going to be resolved by further studies of the Western medical journals. Because as many people are aware, that the medical system as it's designed now, and particularly in the way research is conducted, really disadvantages the evaluation of alternative practices. And so there was really no simple way of getting that answer within the system. So that's when I started to wander further afield, starting to read books, particularly about Chinese medicine, Ayurveda, which is Indian medicine, and then looking at lifestyle. And I was also studying those patients that I had who were healthy, and particularly those very elderly people who were very healthy, and trying to understand what it was about their lives that made them as healthy as they were. I was also informed in traveling, when I went to Europe in particular, which I had the opportunity to do several times, and seeing how Europeans lived their lives. While many of the same stressors existed, they seemed to be less stressed, and their health was in better balance. And to me, ultimately, it was a search for balance and a way to help my patients achieve balance that led me to where I am now.